Call the meeting to order for the Finance and Governance Committee for May the 11th. And Madam Clerk, roll call and posting of the agenda.
Councilmember Turan,
Here.
Councilmember Basua,
Here.
Chair Zaragoza.
Here.
The agenda for this meeting was posted in the City Hall kiosk on Tuesday, May 4th, 2021. Thank you.
Thank you. And please join me to the salute of our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, indivisible, with liberty and justice for all. Thank you. Okay, item B is public items not on the agenda, and we have one speaker, Mr. Larry Stein, Lawrence Stein, for 3 minutes.
Mr. Stein?
Hello.
Yes, hi, Mr.
Thank you.
Stein. You have 3 minutes to speak.
As you are aware, there are certain facts that pertain to the AWTF, the Advanced Water Treatment Facility. The facility was enacted through City Council, who suggested in 2010. So the AWTF is going to be the backbone of the city's water supply. The AWTF infrastructure was completed in 2012, September 2012. What needs to make it potable water is ASR wells, Advanced Storage and Recovery wells. Those wells were never built. The plan to build the wells, but the wells have not been built. But debt service was incurred. So we have 40,000 plus users of potable water paying the debt service on non-potable water. This is an issue I've been talking about for a number of years. These are facts. Fact is, so the ASR well is built, and the potable water users are paying debt service for water they're not getting. This appears to be a violation of Prop 218 because ratepayers of one class are not supposed to subsidize the cost of another ratepayer. The users of non-potable water are receiving a benefit of the AWTF, but only paying 1%, if that, the total debt service. The 40,000 ratepayers are paying the debt service on $7.5 million per year on an annual basis, or $15 per month. Again, City Council has not approved the finalization of the AWTF of the ASR wells. The ASR wells at this point in time are a future benefit. Prop 218 also addresses the issues of future benefits. The users of the potable water are not supposed to pay for a future benefit. At this point in time, the ASR wells are future benefits. The construction of the ASR wells should be built by the general fund or the user of non-potable water, because they're the ones that are benefiting by the non-potable water at this point in time. Again, thank you for your time and just consideration. Please remember that the current ratepayers, 40,000 plus ratepayers of potable water, are paying at least $15 per month on debt service as part of their meter fees. And that seems to be illegal. 805-824-4970 is my
40
phone number if you wish to
seconds.
call me about these issues.
Thank you, Mr. Stein. Okay, our next item, and I'll read this and then we'll have Mr. Stein speak again. Next item is C1, the Fire Department. This is to establishment of ambulance transportation fees. And the recommendation is the Finance and Governance Committee recommend to the City Council, number one, to conduct a public hearing to consider the establishment of ambulance transportation fees. And number two, following the public hearing, adopt a resolution establishing applying ambulances transportation fees. And this is pre-recorded per Measure M. And before we continue, council members, we have one speaker, Mr. Larry Stein. Lawrence Stein, 3 minutes.
Mr. Stein? Mr. Stein?
Yes.
Yes, you have 3 minutes to speak. Thank you.
Which item is this now?
C1, the ambulance.
C1.
Okay. The issue with the ambulance is the fact that we have a large majority of our calls for service right now in the fire department is for ALS and BLS calls for service. That's advanced life support or basic life support. Again, it's 80% of calls for service. Right now, we're in a contract and we use certain ambulance services. I would suggest that we negotiate with the county or the ambulance services to provide all the ALS, BLS calls for service, because this is what the negotiations are taking place now. So the fire department is not providing the, if the ambulance services are supposed to provide all the ALS, BLS calls for service per contract, and they're not providing that service, then many people in South Oxnard, I've been told, who will not receive services because the ambulance companies would just soon pay a fine versus provide service that people can't afford the service. I'd like to have this addressed in further action. Again, the fact that we have 80% of calls for service are for ALS and BLS calls for service. We have 8 fire stations, and the average call for a fire is 1.5 calls per day for all the fire stations. It seems to me that our resources are being over capitalized if these services are supposed to be provided by ambulance companies. Again, thank you for your time and just consideration.
Thank you, Mr. Stein. Chief Hamilton, you'd like to make some comments on this item from Mr. Stein?
Yeah, thank you, Mayor. And I believe that Mr. Stein may be a little bit confused about where we're at, but just to the point he was making is exactly why we're in this position today, is because we are working on providing more equitable ambulance service to all Oxnard residents. So this is actually something that Mr. Stein has been very passionate about over the years, and we are making moves towards some of the things that he's been talking about in that time. So perhaps I'll reach out to him so I can explain what our goals are, so that he has a better understanding of it, because I believe this is what he's been talking about for quite some time.
Thank you, Chief. Council members, do you have any concerns, questions I would ask the Chief at this time? Okay, Councilmember Tehran. Councilmember Tehran.
Yes, thank you, Mayor.
Mm.
Chief Hamilton, just a couple of questions for the benefit of the public. I would encourage the public to view the presentation because they can't see it here tonight because of Measure M, but there's some really important information on there. One of them being something that I think can help dispel a claim that I've heard made by 1 or 2 members of the public, in that when they hear the phrase user fees, I don't know if it's an assumption or a misconception that this program will be a profit to the city on the backs of people who cannot afford ambulance services, or who will be burdened with debt in the future because of ambulance services. And I'm hoping that we can, if you would be willing to answer or speak to that. And I'm specifically looking at slide 9, which is looking at the payer mix for Oxnard, and it shows the percentage of users for this service who are on Medicare, Medi-Cal, have their own private insurance, or who would be private pay. So we just speak to that and what user fees are and what that would look like specific to the city of Oxnard and our lower income communities.
Absolutely. Thank you for the question, Councilmember Tehran. So what I will say is, when we talk about user fees, they are the same fees that people are getting charged right now if they take an ambulance ride to a hospital. And so all we're saying is we're going to use those same fees that currently exist, and try and use them in a more equitable fashion and use them to better effect. So, and to comment on, as you mentioned, slide 9, which has the payer mix. So the payer mix is really important to understand, because that's what creates the value in the system, or it shows what our cost recovery would be to cover the costs of providing EMS services. So as a general rule, and this is the way healthcare is across this nation, is that commercial insurance generally pays the highest reimbursement rates. We have set rates that Medicare and Medi-Cal pay that are generally considerably lower than what we get from commercial insurance holders. And then we expect less of a reimbursement from private pay or people that don't have health insurance. One of the really exciting things that we can do with this ambulance program is, and it's something for council to consider at a future meeting, would be a compassionate billing policy. And just to your point, Councilmember Turan, that would allow us to create different programs for our residents that are struggling. There are other areas of the state that have these compassionate billing policies, and it can take a whole range of different forms, but that is a way that we can help support our residents through this program. So it can be that we can say, as a compassionate billing policy, we will not collect on any copays or deductibles. We can set up payment plans for people that cannot afford to pay their full bill, and so they can pay it over months or years. One of the other things that happens is that Medicare only pays for 80% of an ambulance bill up to a maximum of $480. And so there is a position that we could take, that we would charge the balance to that Medicare holder, or again, as with a compassionate billing policy, we would say, no, we're not going to do that. So that gives us a range of options to be able to better support our poorer residents. So it's something that I look forward to bringing back to the full council in the not too distant future. We're working on a draft of that right now.
All right, thank you for that. And I think something you mentioned is very important, that, correct me if I'm wrong, that the fees that are going to be paid with this contract as things move forward, we're paying that now to the contractor who's currently contracted with the county to provide ambulance service, correct? And then this is only an assumption on my part that the current system, that money goes to that agency or that contractor for ambulance service, and then goes wherever that company decides to use it. Whereas in this case, with it being local control, us having the contract directly between the city and the ambulance service, we wouldn't make a profit on that. That would be more of a reinvestment in the community. Is that correct?
Yeah, and if I could just make one small correction for you, Councilmember Turan, is that the current provider, they do all the billing and all the collections. So any profits that they make go back to their private equity company in Colorado Springs. What we're saying is that we would assume the billing. We would pay a flat fee to the ambulance company, essentially an hourly rate to the ambulance company to provide those ambulance services. And then if there is any positive cost recovery, we'll reinvest that back into our EMS system, provide more services to our residents. Does that answer the question?
It does, yes. I was just hoping to make that distinction for the public on what currently exists versus what is proposed with this contract. Thank you very much. Those are my questions, Mayor.
Thank you, Councilmember. I'd like to follow up a little bit on that, Chief. You know, on slide 16 of your presentation, I am going back even to slide 15, where you compare the rates from different cities like Chula Vista and the County of Ventura and so forth. And you come out with our new rate that you're proposing would be the new Oxnard ambulance rates are projected to produce cost savings to our city. For example, the County of Ventura currently the base rate is $2,253 compared to the potential rate for Oxnard for $2,161, with a savings of $91.28 per transportation. And I think you mentioned to me that that's in keeping with Prop 26. Is that correct?
Yeah, that's correct. So basically, to stay in compliance with Prop 26, we conducted this fee study, and based on all the costs associated with providing the current level of EMS service, we believe that the projected rate that you mentioned, $2,161.72, would be adequate to cover the costs of providing those services, which does come in a little bit lower than the county's current rate, and obviously significantly lower than the city of Chula Vista's rate.
That would be very significant, as you mentioned, because we have transportation after transportation, that adds up considerably. Then on slide 18, you said the projected 5-year net revenues available to reinvest in EMS is pretty important, starting from 21, 22, 122,000 going all the way to 25, 26 of 1,000,004, almost 1,000,005 is pretty significant investment revenue, projected reinvestment into the EMS system, which I think coming up with Councilmember Tehran's questions, that I think the people or residents need to understand, which I think is extremely important.
Yeah, and Mayor, to talk just briefly on those, when we talk about EMS reinvestments, there is a whole range of innovations that we could make with those reinvestments. The simplest example would be to use those reinvestments for more ambulances on the road.
That's right.
So that we can have more ambulances. But I think we can do better than that. And so we can provide a telemedicine service for people that call 911 on those lower acuity calls. We can potentially establish a unit that would just respond on our homeless population and be able to really focus in on their needs if they have work with our housing and homeless teams to be able to get those people into services. And currently right now, if you call it for an ambulance, your only choice is to either not get in the ambulance or go to the emergency room. We now have the ability that maybe we could use the alternate destination legislation that was just enacted. So if there's somebody that has a substance abuse issue, we could take them to a substance abuse facility. So we can get our residents to the right care. And that's just a couple of examples of some of the reinvestments that we could do with those funds.
Thank you. And my last question here, Chief, on slide 13, this is very transparent. I like this where you have the breakdown of admin and supplies that you put down, for example, the medical director, X amount of dollars, the dispatch services, the cap replacement, the EMS coordinator. That's pretty significant. So just running a ambulance, we see an ambulance run up and down or from point A to point B, but it takes a tremendous amount of administration and supplies and coordination to do that work. So I think it's very significant for the public to see that.
Absolutely.
Thank you, council members. Any additional questions on this item? If not, what's the pleasure of the council?
I will move the recommended action, Mayor.
Okay, moved by Councilwoman Basua
I'll second.
and second by Councilmember Tehran. Roll call.
Councilmember Tehran,
Yes.
Councilmember Basua,
Yes.
Chair Zaragoza.
Yes.
Thank you. Motion passes 3-0.
And thank you so much. And we have another speaker on this item, but let me go ahead and present it first. And this is again from item number 2, C2, the Finance Department. And the subjects of proposed the City Council policy for internal control, integrated framework, information and communication. And the recommendation is that the Finance and Governance Committee provide feedback on a proposed City Council policy for internal control, integrated framework, information and communication, and recommend to the City Council approval of the proposed policy. And again, this was required by Measure M, a pre-recorded presentation. And before we continue, I have a speaker on this item, and that's Mr. Lawrence Stein.
Mr. Stein?
Good evening, Mayor, members of this committee. Internal controls is something I've been following the city for a considerable period of time. There have been weaknesses already in internal controls, and these weaknesses have been discussed numerous times by our internal auditors, saying we have significant weaknesses in internal controls. As an example, I've looked at documents, we've written checks for over $1 million, and only signatures on the approval for those checks have been directors. There have been no approvals by City Council, no approvals by the CFO, no approvals by the city manager. The only approvals on that document for those $1 million check was the director. Again, this is one example of internal weaknesses. Other documents, such as when we used to have the contracts with NAPA, They would never audit the actual comparison of amounts on those contracts. So we have significant needs for internal controls. We've gone through numerous CFOs, and every time you look at issues, or I look at issues, I find significant weaknesses in internal controls. I don't know what the issue is with City Council not reviewing the actual documents. City Council does not review the checks that are actually being issued on a bi-weekly basis. There are laws in place that City Council is supposed to be reviewing documents on a regular basis and announcing to the public that they've reviewed these documents. City Council has not done this for over 25 years. Again, internal controls need to be improved. And City Councils actually follow procedures where they actually care whether money gets spent or not, and approvals actually get signed or not by the appropriate parties. Again, thank you for your time.
Thank you. Council members, any concerns on this item or any comments that they'd like to share at this time? Let me see, Councilwoman Basua, followed by Councilmember Turan.
Thank you, Mayor. I want to really commend staff for all the work that they have put into this policy document. Since my time sitting here as a council member, I have personally witnessed all the work that the finance team has done in order to get us to today. And I hope to continue to see the progress that the finance team is making. With that being said, Mr. Stein did bring up some of his concerns, and just having worked in government and still working in government, I know that there's internal controls as far as paying invoices with purchase orders. Sometimes purchase orders get signed by top management, and when the invoices come in, that's authorization to go ahead and pay those invoices. So I'm positive that there are internal controls there in order to make sure that these kinds of things don't happen. But I also understand that we're human. So, but I do want to just make sure that we give credit where credit is due. And I know that Mr. Riper's team have been doing everything possible to get us to where we are today. So those are my comments, Mayor. Thank you.
Thank you so much, Councilwoman. Councilmember Turan.
Thank you, Mayor. I also want to commend Mr. Riper and all of his staff for all of the work that's been put into this. We are almost through all of these internal controls, as you can see in the presentation. And I have a couple of questions. The first is regarding the one that's in front of us today with transparency and complete information and communication. I'm just wondering if Mr. Riper or someone on staff can just give an example for the public of what that tangibly would look like, this policy put in place when it goes to council. Do we know, what can the public expect to see as an internal control around communication from the city? And then I have a follow-up question after that.
Certainly, Councilmember Turan, through you, Mayor.
Yeah.
A good example of City Council fulfilling its role in this recommended policy would be Council routinely asking management for updates on internal control policies, remedying of remaining weaknesses, and this particular committee in fulfilling its role as the audit committee. The staff report talks about an earlier internal control integrated framework policy adopted by council that sets the Finance and Governance Committee as the audit committee under the internal control framework. Another example is City Council reviewing and paying attention to the single audit that's reported by the auditors every year, and which was done just a couple of weeks ago, and following up with questions of city staff on that, city staff and the external auditors on the findings in the single audit each year.
Great, thank you very much. It sounds to me like a lot of what's been put in place and started to happen, and we are now formalizing that as a formal policy to be able to ask those follow-up questions, do those regular reviews, and have the Finance and Governance Committee act as that audit, that audit component. So
Exactly so.
great, thank you. And just very quickly too, I know Mr. Stein had a few questions and comments that he had put in there. In regards to the example that he used, and I know Councilmember Basua had mentioned it as well, for directors signing checks, just based on my limited experience and what I've learned from our internal auditors around an actual internal weakness, or what they've referred to as a material weakness, are these actual findings that our auditors have found where this would be an issue, the examples that were brought up by Mr. Stein?
Not the signing of checks by department directors, because 2 department directors in Oxnard sign checks, the Director of Billing and Licensing and the CFO. But certainly the example he gave from 2015 about the check that was not fully documented is something that our auditors found, or perhaps similar examples, back when they did the audits for 2015 and 2016. But those have not been findings at the city for 5 years.
Great. So it sounds like that's been corrected.
That's right.
Great. Thank you very much. Thank you, Mr. Riper. And those are my questions, Mayor.
Thank you. And also I have, I was looking again at slide 4 and 5. First of all, I'd like to commend Riper for the work he's done, looking at the chronology, going back to control environments, dating back to 9/1 of 20, where the city council adopted 1 to 5 city council policies, adoption of internal control, oversight, committees with responsibilities, and et cetera, and going on to risk assessment with in 1/5/21 city council risk assessment responsibilities, and then C, control activities, development of implementation and internal controls. And now we're looking at, as was mentioned before, the commitment to transparent and complete information and communication to the public is really important. And of course, the creation of monitoring system. And you go into slide 5 that now implementing policy defined city council internal control activities as they relate to information and communication and controls, and draft policy information by the city council commitment to hold management accountable. And that's one of the important things for providing full and transparent financial information to the public, which I think is extremely important. But, the city manager. Oh, okay, Mr. City Manager, I see your little hand up.
Yes.
That's my part that I just wanted to comment on, but Mr. City Manager, go ahead.
Thank you, Mr. Mayor. And through the chair, I want to also add to an explanation in response to Councilmember Turan's comments and questions in response, therefore, to one of Mr. Stein's points. He referred to something that also happened quite a while ago, the NAPA contract. And I just want to reassure Mr. Stein that not only did we correct the problem around managing that contract, we also terminated the city's contract with NAPA 2 years ago. So I just want to remind him of that. Thank you. And I'm working on the Zoom setting to try to make my hand larger, but I haven't figured it out. But I'm trying.
We saw little hands setting up, so
Thank you.
thank you so much. Okay, council members, what is your pleasure on this item?
I will move the recommended action.
Okay,
And I will second.
first by Councilman Basu and second by Councilmember Turan. Roll call.
Councilmember Basua,
Yes.
Councilmember Turan,
Yes.
Chair Zaragoza.
Yes.
Thank you. Motion passes 3-0.
Okay, our next item, we have a couple of speakers on this item, but let me go ahead and read this item first. This is a Public Works Department Utility Rates Assistance Program Project Assist Update. Recommendation that the Finance and Governance Committee recommend to the City Council. Number 1, to adopt a resolution for the Utility Ratepayers Assistance Program Project Assist for fiscal year 2022 to assist eligible Oxnard residents in authorizing staff to grant financial relief equal to a monthly amount of $15 maximum credit per utility bill charges to customers who meet the eligibility requirements discussed in the staff report. Also, number 2, authorize the staff to direct $145,000 from the penalty fee charged to city utility customers who pay their bills late to fund the Utility Ratepayers Assistance Program Project Assist in the year 21-22. And again, this is There's a pre-recorded per Measure M on this item. And I have a couple of speakers on this item. And we'll start off with Mr. Lawrence Stein, followed by Angela M. Whitecomb. Lawrence Stein.
Mr. Stein,
First, to address an item that was just previously discussed, the last 5 years, the check $1.3 million has been issued by redevelopment. There's been no countersignatures for those checks of $1.3 million, River Park Legacy A. Again, this is an item of discussion. I commented last fiscal period on this. And again, this project is still taking place. The fact we are still, again, on the issue that was pertaining to the last item. On this issue, I'm somewhat concerned with the fact that the current ratepayers of potable water are paying approximately $15 per month for debt service on the AWTF that are not getting a benefit from. So I would recommend that instead of going through an emergency plan where people can actually ask for money or reduction on the water bill if they need it, that city goes forth and reduces the water bill or the meter fee for each water user by the $15 per month, representing the debt service on the AWTF that people have been paying since 2012 but not getting a benefit from. They are not getting any water from AWTF. The water from AWTF is not going to the general water supply, but is benefiting certain private entities who are only paying 1% of the debt service. So in compensation to the ratepayers, perhaps the monthly bill should be reduced by $15 a month to reflect the debt service that they've been paying in the past for water they're not getting. Again, I'm somewhat concerned the fact we're paying debt service on water we're not getting, and seems to be ignoring this fact. Again, thank you for your time and consideration.
Thank you so much, Mr. Stein. Our next speaker is Whitecomb, Angela Whitecomb. 3 minutes.
Mayor, Ms. Whitecomb is not available.
Okay. Council members, any questions? I think we have Jay Duncan is available for any questions. Is that right, Jay? Okay, any questions or concerns? Or okay, Councilmember Tehran.
Thank you very much, Mr. Mayor. Thank you for putting this all together. This is a program that that landed on my radar just around the time that the wastewater rates issue was very big in our city. And I commend the city for finding a way to provide assistance to those who need it for our utilities that are provided by the city itself. A question that I have, and I know it's stated already in the presentation and in the staff report, but just so the public can hear this, is if they find themselves at any time in the year, they don't need this program, but then later, for whatever reason, life circumstances change, financial situation changes, can they apply for the program at any time during the year? And as a second question, we see that there was $0 collected in late penalties for much of the previous fiscal year, or up until this, I'm sorry, the current fiscal year, because we're not assessing penalties. Does that, we will still be able to utilize the program though, because we can use funding from other fiscal years. Is that correct? So those are my two questions.
Jay. Jay, you're unmute yourself. Still muted.
Yes, Mr. Mayor.
Yeah, go ahead, Jay.
Mr. Mayor, Councilmember Tehran, that's correct. The penalty fees can be used in fiscal years that they're not incurred. And that's how we're able to cover the expenses for the program. And if City Council were to approve it tonight for in year 5, we would be able to utilize those penalty fees. Could you just repeat your first question?
Yes, essentially, can people apply at any time during the fiscal year if they find themselves in a situation where they'd like to apply for this program?
Mr. Mayor, Councilmember Tehran, that's correct. They can apply at any point during the fiscal year and get on the train, so to speak. and become project assist participants. We do have, we ask the returning participants and of course the new enrollees to apply once per fiscal year. That way we ensure the due diligence that they meet the eligibility requirements, and it helps track the program.
Great, thank you very much. And I just want to say I wanted to pose that question because I did hear from a resident previously when they realized they needed this program, they thought you could only apply during a certain time window. And so I appreciate you sharing that, because at any given time we can find ourselves where any assistance we can get would be helpful. So thank you for answering that question, Mr. Duncan.
Thank you, Councilman.
Go ahead, Sherry, we have a question.
And I just want to clarify, the committee tonight is only making a recommendation to council, not
Right.
actually approving.
Exactly right. This is a recommendation just for information. Okay, Jay, the question I have is, do we still have 145,000, or is this up to 145,000 we collect in penalties in that account?
Mr. Mayor, Finance and Governance Committee. So we've expended approximately 121,000 of that 145,000 from the penalty fees. And so the money's there to cover expense, obviously this fiscal year, but as well as if there were, if the city council, the governance committee decides to forward this to city council for a possible year 5. There is funding from last fiscal year to cover that, and that's approximately a little over $1.1 million.
So there's carryovers, and Jay, that's what's happening. The question I'm asking, and I think probably Councilman Duran alluded to this, because of the pandemic, because of the COVID-19, and because of a lot of people have been out of work and so forth. Can we potentially maybe recommend to the city council that that be increased to $20 for that 1 year only? You know, that'd be a possibility. I had to see the city manager has his hand up. Mr. City Manager.
Yes, thank you, Mr. Mayor and the committee. I think that's a very natural inclination. What I'd like to do is, when this goes to the council, to wrap in for everyone what else is available through the various CARES Acts funding that's come in through the state and the county for utility bill payments. Because I know we have some of our clients have already applied to those programs. And I think the governor may have announced even a new bucket of money for this.
So we can look at it because
I think there's a nuance here where, as if you think of this program as it is without the pandemic, it's a pure policy decision by the council in terms of what we do and how much we do. And then when you layer on the pandemic, again, I think it's natural to be inclined to increase it. I think that's a great policy discussion to have, but I also want to have that policy in the context of the other funding made available through the feds and the state, so that we can understand what we're looking at. So I think I'd like to bring that when this goes to the council, what those buckets of funds are available.
And that's a good, because there's 5 priorities or items that we have to look at. It's potentially that could be one of them where we can assist. Thank you for that, Mr. City. Council members, any other questions on this item? I think this item is really, really important because there's a lot of people that really need that. $15 could mean, a couple of days of food, for the individual. So I think it's an excellent program that we assist, especially this year with the pandemic and the COVID-19. And I think the city manager has some good ideas that potentially we can assist in not only this item and other items too. So council members, what's the pleasure on this?
I will move the recommended action.
Okay.
I will second.
Okay, first by Councilmember Turan, second by Councilwoman Basua. Roll call.
Councilmember Turan,
Yes.
Councilmember Basua,
Yes.
Chair Zaragoza.
Yes.
Thank you. Motion passes 3-0.
And council members, item number D, is there any items for future agendas for this Finance and Governance Committee, council members?
Actually, Mayor, I don't really have a item, but I do have a question. I haven't seen the minutes for a long while, actually. So I'm wondering when we're going to get to those, because we're just going to have a lot of stuff to go over when we do get those.
Madam Clerk, can you share some information on the minutes?
Councilmember Basua, we are currently working on catching up on minutes. You will see those very soon. Thank you.
Okay, thank you.
Thank you.
I just don't want to have months and months of minutes to review. But
And-
thank you, I appreciate that.
And that's a good point. We need minutes that are extremely important. I know that clerk is shaking yes on that item. Thank you, Councilman Basua. Okay, if we don't have any additional items, then we're going to adjourn. And just for the county, for the public's information, the Community Service Public Safety Committee has no items from 6:45 to 8:15, so there's no items there. But our next item is going to be the Public Works and Transportation Committee at 8:30. So we are adjourned until 8:30. Thank you so much.